just you think about our center, think about our children, orphan children living with HIV/AIDS, or the people who living with HIV/AIDS. You just think about them. You support in dimension of spiritual as well. Thank you very much. It opened on 29th of January 1996. At the first 10 years, our children could not go to school outside because of stigma. But when we started this center, we didn't just get the people to live here, but at the same time, we try to distribute the right information about HIV/AIDS. But the people there at Nonthaburi, they didn't accept us. They tried to push our center out from their society by bomb and gun. They threw the bomb to our office and forced us to leave from our center. The stigma from the people in society. So it forced us to work about how to let the people outside our center get understand about HIV. Our center help the HIV/AIDS patients who are poor, who are rejected by the people in local community. And they were sent to our center. Someone came here with the position of they are very weak. So we separate them into three steps. First, they are very weak. We will put them in the first room that our staff, our caregiver, who are also HIV people, will help them everything for their daily life. When they get better, we will move them to the second step that will help them to exercise themselves to get stronger. But someone, they still live with this, some disability. For example, they are blind, they are disabled. So our staff will help them in their daily life as well. When they reach the situation of their health, they are strong, they move to the last step, the third step, that we will support them to stay or to live in their own family or in the society. When the children were born by HIV mother, not everyone get HIV. It depends.
Okay.
If the mother get the ARV, antiretroviral medicine, during her pregnant, almost 0%.
Zero, really?
Yes.
So it's very few cases. Wow.
Yeah. Not very few cases. In this, at the present, almost of them they have no HIV because the mother go to hospital and get the medicine.
Yeah.
The Thai people they don't need to pay for the medicine. Mm-hmm. This building is for female.
Yeah.
Mm-hmm. But at the first floor, the children can do activity together. For example, even it is written the computer room, but we didn't put the computer here.
Okay.
Yes.
Because if the children use the computer by themselves, so they can get through the bad website.
Yeah.
The children who come here, they will live until they will be ready to live by themselves in Thai society.
Yeah.
So we support them to help to reach and get education. So when they leave our center, they can take care of themselves.
When they leave the center and go back to community, that you also try to inform the community about it's not dangerous and they're safe
Yeah,
and everything.
now we are doing
Yeah.
to let the people in the community and in local community to have the information about HIV/AIDS. So they understand and accept our children who leave our center and live in society, in local community.
Yeah. That's good.
You can see this playground. 2 years ago, one day, there was a Scottish worker who worked in Thailand. He came into our center and asked us, "What do you want me to help you?" At that time, I think about this then because here we have a lot of children and they need the place to play. I think about the playground. And I asked him, if you want to support or help our center, our children, may I ask for the playground? So he contacted a company. So he ordered direct to the company and paid direct to the company. And we got this playground. You can see the sign of his name here.
Oh, okay.
His name is Bob Davidson. It is our work when we started this center because of the stigma in Thai society. So this office, we have 4 staff to give the information about HIV/AIDS to the people outside. Sometimes we invite them to learn about HIV/AIDS in this center. At the same time, the people outside who are fear about HIV/AIDS, they can come get information. After, when they go out, they get understanding and don't fear the patient.
Yeah.
We have a lot of information, the book, the knowledge about HIV, how to prevent and protect themselves from HIV/AIDS. This is the passport about the knowledge of HIV/AIDS. The people can get this passport, especially this is in English and Thai. You can know and check yourself that what is HIV, what is AIDS. This dome is used for keep the ashes of the HIV patient who passed away. So we do the cremation and we keep the ashes here.
Yeah.
Since the beginning of this center until now, there are around nearly 1,000 dead bodies. So we do according to the Buddhist tradition to put the ashes into the sea. For Catholic, we keep the body into the land. And if you have time to come to Thailand, please visit us here at Rayong Chameleon Social Center Rayong.